So this is my simulation observation project by Diana Crane. So the simulation I attended was a joint project between the nursing and medical students for Rochester Regional Health Services. The goal was to teach medical students and nursing staff to work together to create good patient outcomes. So there were 3 first-year medical students and 3 nurses that participated, and they had 3 scenarios: a code, a patient suffering from an acute MI, and a patient suffering from low blood sugar. The team was to work together to determine what interventions were needed and how to implement them. So the 3 scenarios were set up in 3 different labs on our Reedman Campus Education Center. 3 first-year residents were present. It is the expectation that all first-year residents attend the simulation at least once during their first year. 3 nurses from different areas of the hospital were asked to attend. This is voluntary for the nursing staff. The nurses are selected by the program director and are a mix of age, gender, and different levels of experience. The participants were introduced to each other and an overview of the program was given. The participants are then directed into the first scenario, the patient with a low BG. This patient is an ED admit, a 70-year-old female. The nurses enter first and gather preliminary information. There is a definite tendency of the nurses to look to the most experienced nurse, which was Melissa, who has 12 years experience, for cues. The nurses check vital signs, BG, and speak with the patient who is obviously confused. The residents are then called in as the vital signs are stable, but the patient is diaphoretic, confused, and has a BG of 43. While they are called by one nurse, the other 2 nurses attempt to give the patient juice. The resident team then is briefed on the situation. They ordered IV dextrose and D5W to infuse. The patient is rechecked with a BG of 82 and then 117. The scenario ends. Then the second scenario is started. That's a patient with an acute MI. The same format is used. The nurses enter, this time the newer nurses, John with 2 years experience and Kara with 1 year experience, seem more comfortable with this exercise. The patient reports nausea and vomiting and chest pain. The nurses get vital signs, blood pressure 160/82 and a heart rate of 127. An EKG is done by the 2 of the nurses while the other calls the team. The team is then briefed by the nurses and orders labs, 325 milligrams of aspirin and cardiac monitoring. The whole team discusses and decides that maybe ICU should be contacted and cardiology should be called. This scenario ends with cardiology at the bedside. The last simulation is a patient who presents as not feeling right and quickly becomes unresponsive as the nurses are checking vital signs and attempting to get a history. The team is called immediately, and the 6 participants are put through a code scenario: IV medications, chest compressions, and eventually the loss of the patient. The resident team then has to inform the family of the patient that is in the waiting room that their family member did not survive. So the 3 scenarios played out. The last was the loss of the patient. The team debriefs as a group after that, discussing what went well and what could have gone better. The 6 participants report feeling more empathy for the role of the other disciplines and increased awareness of communication skills. So the debriefing lasted about an hour and was done in an informal group setting with the chairs in a circle. The director opened with the direction to first discuss what went poorly. The nurses felt that the team was quick to question their assessment of the situation. The nurses also felt that the team was dismissive of their suggestions of how to proceed. The nurses felt that the team seemed to ask them questions about the care given that were interpreted as if nurses don't know how to handle things. The team felt the nurses were quick to decide what the problem was and did not want to entertain the idea that an issue may lie elsewhere, and that the nurses wanted quick fixes to the problem at hand. This was discussed. The nurses explained that they have experience and have been trained to see and check certain things when a patient presents with them, such as an EKG with chest pain or a BG on a confused diaphoretic patient. The team explained that they are trying to make sure that they do not miss anything and are afraid that if they focus on one thing, another issue might be missed. Or that if they only see a low BG and give juice, then what caused the low BG? The director then asked what went well. I was told that this was to ensure that everyone leaves on a positive note. Both the nurses and the medical students felt that they were able to collaborate to treat the patients and that communication, while complex and difficult at times, was fairly well done. The team ended with a comment of how easy it is to forget that we are a team and others can help to direct their diagnosis. After only focusing on the physician's point of view in medical school, they seem to be new at the idea that we are a team and nurses can collaborate with them. The nurses explained that they had not realized that the residents were concerned about different causes of the issue from the very beginning, and commenting on how it was interesting that as nursing students, we are constantly reminded of how to work with doctors, but the medical students are not taught that nurses can be a great asset. This simulation was fairly realistic and engaging. The nurses and the residents both seemed to gain confidence as they progressed through the different scenarios. They seemed more willing to jump in and start treating the patient and more willing to offer their opinions and recommendations as they progressed through each scenario. During the debriefing, the conversation was friendly and collegial, with none of the forced quality that can be seen at the bedside. The point of this exercise is to foster teamwork, and I feel that it did work towards that goal. I was asked to participate in this same simulation 3 years ago as one of the nurses, and I can report that the residents that I worked with are still willing to listen to my concerns and suggestions as the current attending physicians they are in my hospital. I have seen them coaching their residents to listen and respond to the nursing staff as partners in care, which is a switch from when I started, and it was more of a hierarchy than a partnership. I assist with a simulation for students at GCC as well, and I can see real understanding begin to take hold when students are using the simulations that are assigned to them. I believe that the experience and active learning principles that are applied to the use of simulations are well thought out and accurate. It allows students to learn in a safe arena and practice without the potential to harm a patient. This allows them to be more skilled and confident at the bedside. Thank you.